At this time, I'd like to introduce our speakers, Bret Shillingstad and Jill Machut. Bret is the Executive Director of Optimization Services at Nuance. He is a general surgeon who, after 9 years of having his own practice, spent almost 13 years with Epic as the Director of Clinical Informatics. Dr. Shillingstad's passion in helping physicians optimally utilize Epic led him to join Nuance and advance our optimization services team's mission of improving outcomes, quality measures, and clinical efficiency for our Epic clients. Jill is the Director of Optimization Services at Nuance. She joined us as part of the Physician Technology Partner acquisition, and as such has been working with our Epic clients for over 3 years. Prior to Nuance, Jill worked at Epic for 8 years, focusing in a variety of areas, including optimization projects. Jill's experience working with a multitude and variety of clients throughout her tenure at Epic and Nuance has allowed her to pursue her desire to help her clients overcome challenges with the use of Epic and drive positive results. So at this time, Bret and Jill, you may begin.
Okay, great. It's great to be on the call today, and we're going to give you a summary of the Epic optimization services that we're offering. And we're both very excited to be offering this. Both Jill and I did a lot of this at Epic when we were there, but what we did when we were there was really go out and do post-live reports and optimization visits and create a lot of great lists of enhancements and leave those with the customers. What we're doing that goes beyond that is actually not only creating that great list that we did, but we're also doing all of the build in a test or POC environment. So all you have to do is test and migrate that to your production environment. And the other nice benefit we're offering is one-on-one training at elbow support to take people beyond where they're at today, both from a voice recognition and clinical documentation standpoint, as well as optimizing all of Epic and all of the pieces of Epic that are used. So we have an agenda here that we're going to be following with some of the industry challenges, services we're offering, and how the program works. So in moving forward, we're going to start out by talking about the Quadruple Aim. The Quadruple Aim is looking at ways to really leverage the EHR to get improved outcomes. And one piece of the Quadruple Aim that is being focused on is improved clinical satisfaction. And one thing that we see commonly is people are using the EMR after hours. They're taking a lot of time to document after they leave the room. Many complain they feel as though they're a clerical person putting data into the EMR. And what we want to do is make it very easy to use, improve workflows where actually all the ancillary staff are working at the top of their medical license, and give physicians more time to spend with patients versus navigating technology. And when it comes to documenting, really what people want are 3 things primarily. The first one, when you survey people, is people want more education and training for their clinicians. They want to know how to best leverage the system and how their colleagues use it more effectively than they do. They want to enhance existing technology and tools. There's a lot of stuff underutilized in Epic, both features as well as other third-party systems that aren't being utilized to the extent they could be. So a great example is mobile. Many people are not using mobile technology even though it comes free of charge with Epic. And to be able to use Haiku and Canto, for example, as well as voice recognition from Nuance, we can greatly improve the efficiency of those who are using the system. And this is a great summary that Carl Dvorak presented a few years ago at UGM, talking about realizing the full value of Epic. And when everyone starts out with their go-live and implementation of Epic, everyone's using it relatively well and the same way. But over time, things start to lag. First of all, provider adoption is somewhat stagnant and doesn't improve a lot. Hospital adoption might be a bit better because there's more support and you're more actively using it in the hospital. But Epic development is moving way beyond the pace of both hospital adoption and provider adoption. So what we're trying to do by offering optimization and training of Epic is to turn on all of those features that you're not able to get to with each upgrade. We're going in and finding things that you haven't turned on or leveraged or added to your department profiles and enabling that stuff, and then going in and training people to use the new tools and click on the new features that they're just not using within the system. So I'm going to pass that over to Jill for a bit here to talk a little bit about what we're offering and what we're doing that's different and what the service is that we're offering.
Thanks, Bret. So one thing that we want to focus on throughout optimization is just the value that we bring working with Nuance now. So Bret and I, coming directly from our Epic backgrounds and being very Epic focused, it was exciting for us to join Nuance, where we have all this expertise into the functionality and the technology that Nuance brings. So all of our staff that we've brought on to do optimization are certified in Epic and Nuance technology. They have extensive healthcare expertise, and a lot of them, or most of them, have clinical backgrounds. And those staff that we've brought on that don't have a heavy clinical background, such as an RN or an MD, or any work within the clinic, we are training so that they are experts in the physician workflow, and that's really where we're focusing. But as an organization, we really focus on Nuance EHR Services whole package, from professional staffing all the way through the optimization. So our company as a whole looks at professional staffing, your builders, your trainers. We're doing training programs. We do a lot of personalization, and a lot of you probably know us as the Dragon team. So the Dragon people, and that's what PTP was before Nuance acquisition, was really focusing on Dragon training, but there's a lot more that we're focusing on and really expanding throughout the course of our offerings. And there's a few areas that we measure as we go through and do optimization. Sorry, we're just trying to advance the slide here. Looks like we might be frozen. But some of the areas that we're focusing on measuring, there we go, would be physician efficiency, which is a big one for us. As Bret mentioned before with the graph that we have, the orange line and the green line, and we're trying to move our hospital systems and our Epic builds forward to build a more efficient environment, but also train physicians to use those tools. And if we haven't trained physicians to do that, then we haven't done our job, because that's really our limiting factor. So the measures for efficiency, adoption, we look at Dragon metrics, we look at Epic metrics, rate of throughput, how fast are clinicians getting patients through their visits, documentation time per shift, and then off-hour time. And there's a number of studies that we've been looking at as well, which show the amount of time that physicians are spending either in the EMR or in front of the computer instead of patients. And the latest study we read was that out of an 11.4-hour workday, clinicians are spending 355 minutes or 5.9 hours in front of their EHR. So about half of their day is taken up with charting. So we want to make sure that physicians are as efficient as possible. And we're looking at areas such as the in-basket, where we found that 23.7% of time spent charting is actually in front of the in-basket. And I think that's an area that we can definitely make an improvement on. Just move this forward. There we go. All right. And then one other piece that I mentioned briefly before was Epic and Nuance's integrated solutions. So we have a pretty vast majority of technical tools that we can plug into the Epic EMR, and we have a deep integration and a lot of tools that we can embed along the way. So that's one of the reasons that we really like to weave this into optimization. So anywhere from cloud-based speech recognition, as I mentioned before, the Dragon product, all the way down to CAPD, where we are using documentation within the note reader and tying that into Epic and looking at discrete information. So there's really a lot of tools that we can tie into an optimization project, a lot of time that we can spend not only improving the workflow through training, but also through technology. So there's a few times that we can do optimization. And there's multiple opportunities where we feel that you can weave in optimization to your Epic lifecycle. So these are the areas that we have pulled out. During an Epic Go Live is a big one. And we speak to this a lot whenever we come in and do Go Live support with any organization, whether it be inpatient, outpatient, or specialty areas. The feedback that we hear is that there's a great amount of support throughout the Go Live. We have a lot of people on site, but then at about week 3 or 4, everybody leaves. And we sympathize with that too, because we've seen this workflow. We've seen the physician feedback where providers are now looking to optimize. So it's a great time to add on optimization right at the Go Live whenever we find inefficiencies, just general Epic upgrades. As long as you're getting providers in the classroom, it's a good time to train them. If we're adding on or upgrading Dragon Medical, we mentioned all of our Nuance technology that we have. That's a good time to also train physicians on the efficiencies or upgrade the Epic system to a better build as we're doing Dragon training. If there's a general specialty group struggling with adoption, we have a few engagements that we're doing right now with simply one specialty, such as cardiology, that may just be struggling to get up to speed, and maybe the rest of the areas are doing okay. And that's a good time to just do a cardiology optimization. And then regulatory factors is in there as well. I know there's plenty of mandates from the government on bill that needs to be pushed in, or training or reporting that needs to be done. So I'm going to pass this over to Bret quick to talk about some of the engagement phases and how we do optimization.
So what we do initially is plan out based on specialties that are your biggest areas you'd like us to engage with first. We're using that specialist training specialties type approach where we're going in specialty by specialty and really focusing on the unique workflows and diagnoses and conditions that each specialty encounters. We then do a remote audit of your system. So we go into one of your environments, a copy of production, and we just take a look to see what build is enabled and what features you have and have not turned on in the process. We also look at a lot of the standard reports and make sure all of the reports and tools are effectively set up for physicians to use. Once we've done that remote audit and created an initial list, we then go shadow your physicians and end users as well as the ancillary staff to see how people are using the system. We don't provide any recommendations as to how to set up the system better. The only time we really engage with those people while we're doing observations is if we can point out something very obvious in your current build that would make their life better. Once we have done that analysis on site with shadowing, we then create an issues list. And I would say typically that issues list is about 60 to 80 items that we find per specialty. And certainly we can't fix all of those, and all of those may not be worth fixing out of the gate. So typically we'll sit down with the project team, identify the 15 to 25 big hit items that we can set up that will have a huge return on investment, and we configure those in a test or POC type environment. We have you guys test those items. You don't have to build and do the setup. We know how to do that, and we can do it very quickly. And then that is then migrated into production. This whole process takes maybe 2 to 3 weeks after the initial shadowing, and then we have that build in your production system. At that point, our trainers have been trained on the top items that need to be trained to each end user, and they go armed with the PEP report for that provider, along with our issues list of what we want to train and our training points, and we train them to use the system in the most optimal way within that clinic. We then leave you with the remaining issues that we didn't configure on your issues list so you can work those over time or have us re-engage to do that additional build at a later date and time. The training period that we were talking about, which is elbow to elbow, typically takes about 2 to 2.5 weeks to, on a scheduled basis, go and spend about 2 hours with each physician. Before and after this, we're looking at your PEP scores, but we're not only looking at the PEP scores, but we've also created a lot of our own metrics to show outcomes and ROI as far as this process goes. So for example, we're looking at total charges, RVUs. We're also looking at number of patients seen per clinic template. And one of our goals is for specialists to see at least 1 or 2 more new patients without increasing the length of the day, but rather decreasing the length of the day. And many times a proceduralist seeing 1 to 2 new patients per clinic panel can translate into around $80,000 a year in increased revenue. And then certainly we're tracking clicks. We've shown big click reductions and increased improvement in gathering information by going to fewer screens throughout the process. And then certainly with each additional upgrade, we can certainly re-engage those same specialties over and over again going forward.
Next slide. Next slide.
Yep.
So our approach tends to be very specialty specific, and this was something that Bret and I thought was very important as we started developing the optimization program. And we think in terms of best practices, this is really the way that we should go, where I know a lot of our competitors and a lot of analysis that we used to do was high level, what can we do for physicians, and there's a Thrive program that Epic releases as well, which I think is very valuable and definitely something worth considering. But that definitely approaches things from a high-level ambulatory, inpatient, ASAP type of workflow, whereas we go into each specialty and we look at orthopedics, we look at cardiology, primary care, and we try to focus our training sessions and our build on those items that specialty really needs, since each specialty really has their unique workflows. Some things that we think are also very critical to the success of the program would be leadership support, and I probably can't harp on that enough, even though it's a little bit obvious, is just engaging CMIO level physicians or physician champions in this engagement. Access to Epic metrics. So the PEP report is very valuable for this type of engagement. We can look at how long physicians are spending charting within the visit, or if they're doing any after-hours charting, if they have quick actions set up, or if they have smart phrases set up. So there's a lot of metrics that we can really take when we go into training sessions with providers and really guide the optimization project. And some of the outcomes that we see that Brent kind of alluded to was some improved specialty-based workflows. So we're doing click counts, which is a little bit further on in PowerPoint, where we've gone through, done some changes, maybe some navigators or improved reporting through hyperspace reports, or reduced a couple clicks, or just access activities a little bit easier. So improving screen navigation, improving efficiency, maybe providers get through their day a little bit quicker, or see a couple more patients or even one more patient within any time period, improved satisfaction surveys, along with improved revenue capture. And that's something that we try to do in every visit, is meet with either coders or professional billing staff or any of the staff that's reviewing the chart to see what can we do to train the physicians to either document at a more appropriate level of service or capture procedural charges, for example. Next slide. So there's some actionable metrics that I mentioned in the last slide, but the circle chart to the right here shows the individual learning plans that we're developing. We really do this within both our sessions with providers, but also our follow-up sessions. There's provider skills, and those are captured by our on-site support staff that's working with physicians. And as they're working with physicians, they fill out a survey of sorts on what skills the provider may need to be trained on. So we capture those metrics. Epic reporting, which we've mentioned through PEP, Pulse, Reporting Workbench, Dragon Medical One metrics. So we can take Dragon Medical One, if you have it installed, and look at how fast providers are charting, also how many commands they've created, how much they're utilizing Dragon, and do some additional training if necessary and if that's something that the provider wants. We can look at their mobile platforms. Are they using Haiku? Are they using Canto? We think that's rather underutilized from all the site visits that we've done, and that there's really some improvements we can do with training providers on mobile platforms. And then if Dragon Medical Advisor is implemented in the solution that you've chosen, we can certainly look at those metrics in terms of how physicians are charting and are they meeting all the charting elements. So we take all those metrics and we really develop an individualized learning plan for physicians. And our trainers will go and meet with physicians individually and go through these learning plans. And it's not by any means meant to be a report card. It's more of a guide to really give us more information going through sessions and help with some of those. I think a physician I was working with the other day called it silent sufferers, people who aren't shouting about any inefficiencies with Epic, but are also just getting through their day and could really be more efficient. Okay.
Yeah, so these are some of the things we're tracking, and we're actually incorporating this into dashboards that can be linked or placed on your radar dashboards for each specialty. So at the department level, you could add it to profiles. But some of it is looking at messaging and in-basket and increasing the amount of closed messages and decreasing the number of open messages using quick actions and other ways of leveraging other staff in the workflow. And then charges billed per month. Certainly we're looking at how this affects charges and improved billing and closed encounters and better documented encounters. And then on our next slide, we have another example of some of the clicks. And we've had some huge decreases in number of clicks that we've accomplished in some of our early engagements, where instead of going to 3 or 4 different application reports, end users can go to one screen, get the information they need, or maybe go to 2 screens instead of going to 5 to 6 screens before seeing that patient. And then, of course, increasing the number of new patients per day by getting referrals into clinics faster, more efficient throughput, making non-billable visits very quick, easy by single-clicking on the template instead of spending a lot of time on visits you don't get paid for. And then in the next slide, we have another example of patient encounter completion, getting those encounters closed quickly, so very fast you can get those charts billed and those patients billed, and of course that's going to get you paid faster as well and decrease AR days. And on the next slide, I believe we have a summary of one of our early engagements in gastroenterology, dermatology, and orthopedics, where based on 375 clinic visits per week, we showed that there's about 16,800 fewer clicks. They were going to 5 or 6 screens. Now they can go to 1 or 2 screens per patient just to review the data. Much less instances of scrolling by changing the order of print groups, making it faster to do calculations, increasing the number of auto calculations. So these are all areas that we're looking at for ROI and metrics to show improvement. And then at this point, we'd like to open it up for questions. We know you've been listening to us for quite a while, and just see if there's some specific items you're interested in having us elaborate on.
Great. Thank you so much, Bret and Jill, for your insights into the Epic environment and what our Nuance EHR Services team can do for our clients. As Bret mentioned, at this point that ends our formal presentation. We want to go ahead and open it up to any questions that you may have. As a reminder, today's presentation was recorded, and if you missed any portion of it, you can certainly review it at your leisure, or feel free to send it to a colleague who was unable to join us. You can submit your question using the Q&A panel on the right-hand side within the WebEx interface, and with the few minutes that we have remaining, we will try and address those questions as they come up. I'm going to go ahead and also, sorry, Bret, I think I was getting ahead of myself here. So we do have some closing slides that we do want to go over with you guys as well, but at this point, if anyone has any questions, you are welcome. We'll just give it a minute to see if anything comes in. All right, so there is a question about how you're going to actually get the recording of the session. So anybody who registered for today's event, that link to the recording will be sent to you using the email address that you used to register.
Yeah, as far as specialties that are recommended, generally it's the ones that you feel are suffering and not doing as well. So one way to pick these is to look at your PEP reports, and certainly you're always getting feedback from certain specialties that seem to be struggling more. And those are the ones we typically engage with first. Some of the other areas you might use for identification are those that didn't get the build-out that they needed prior to implementation. So a good example would be you really didn't have time to build out neurosurgery or, say, GI or orthopedics, and you know the build wasn't as robust as it should be. Those are great areas to move to the top of the list. And then one of the other areas is areas where there's been a lot of Epic enhancements. So a great example is orthopedics. A lot of people don't realize that the orthopedics module only adds 2 new features if you buy the module. All of the other features have become part of standard Epic Care. So that's an example where if you didn't configure those orthopedic features with your last upgrade, we could configure all of those -2 without adding any more Epic licenses. So that would be a great area. So I think based on what's in a new release versus what isn't fully built out or your big complainers, those would be the ones that we'd go after first.
Great, thank you. Brett and Jill, there's another question that has come in. Have you seen systems turn off partial dictation and or telephone and completely switch to Dragon?
We have seen that, and a lot of the groups will actually give physicians a drop-dead date at sites where they'll say, look, you can continue partial dictation or transcription for 6 months, but over 6 months we expect you to figure out how to use other tools to do clinical documentation. And then after that time period ends, the physicians who are still using transcription have to pay for those lines. And that's a great motivator to get people moved off of traditional transcription.
Yeah, and I've actually seen this done very well and also not as well. It's kind of a tricky thing to implement if you're turning off transcription since a lot of physicians are very reliant on that workflow. So I think the key really is training physicians on how to best utilize voice recognition using templates, charting tools, and really using voice recognition in the right place. So if they are using the Dragon tool or the voice recognition tool as if it's transcription, it's probably not going to work because they're going to add a lot of clicks on top of that, on top of their transcription. So it's really something where we need to train the appropriate workflow and where to really pick up the shortcuts in Epic in order to make that documentation where they're pointing and clicking and using kind of a partial voice recognition tool match the speed that they could talk into a telephone or a transcription service.
I've got another question here that's come in. Can you talk about, are the individualized learning plans inclusive of Nuance solutions within Epic?
Yes, they are. So it will contain both Nuance as well as Epic training, and then one thing we'll do is actually leave these materials with your trainers so they can continue to use them as you add new people in that specialty. and they can even use it in other specialties that may have related issues or needs.
Okay, we've got another question here that has come in is, what is the recommended optimization approach after the initial optimization effort?
Sure. So optimization is really one of those projects where we can keep going and going, and it really becomes a scope discussion after a while of how much to optimize, so to speak. So after the initial engagement, we find quite a few build and training items which could be implemented, and we talk through that with leadership, with your key decision makers, and your build team, and try to fit in as much as we can in those items that we really think are the most valuable to the project and that we can train physicians in. So we can keep going around and around and doing optimization for forever, essentially, but to try to limit it and just do one focused engagement, we just limit the scope. And our first engagement with build happens, and then our training engagement, and then we do that follow-up training too. So there is some time built into the first initial engagement where we're doing a lot of follow-up work and catching anything that we might not have. But we will leave your organization with a list of any items that we think could be built or further trained, and we'll also help your training staff. So a lot of clients will ask me, can you teach my training staff how to also do this? And absolutely, we're willing to let trainers shadow us or walk along, take our training material, and also help push this out.
And then one other thing I would add is with each upgrade and with the shrinking size of project teams and the decrease in accountable care money, there is an opportunity just to engage Nuance to help with each upgrade and to go and add those new features, turn them on, get them built out much faster than maybe your team could get done, and then to provide the training with each upgrade. So certainly that could be another use case.
Wonderful, great. Thank you so much for your insights into that. I think at this point, Bret and Jill, why don't we go ahead and move on to our last few remaining slides just to kind of wrap up where we are.
Sure. Yeah, I think we just wanted to summarize the optimization process and the best practices to go through and do the analysis, really work with physicians on site. We think it's very important to do the shadowing, the on-site visits where we're working with physicians hand in hand and watching them. So we follow physicians around, we watch them chart, we talk to them, and then execute on all of the metrics that we've gathered while we're doing our analysis and engaging and shadowing physicians. And that's, like we mentioned before, something that's very important to us is to actually perform the build and perform the training as we're going through. We want to make sure that the optimal build is in place that enables physicians to do their job on a specialty-specific workflow. And we really want to guide the process along and enable you all to continue on with optimization and further build and further training by leaving you with a number of tools to kind of increase the workflow, help your trainers, help your build team. So with that, next step, if you'd like to learn more, there's a website here. You can always schedule a brief meeting with us. We're available along with the Nuance account exec. There's a phone number here. And we also have a booth at Epic's UGM coming up next week already. So Bret and I will be at UGM, and if you'd like to meet with us or any of our staff about either Nuance technology, optimization, or any other EHR services, we're more than happy to stop by, set up a brief one-on-one meeting, have lunch or coffee.
Wonderful. Well, Bret and Jill, I want to thank you so much for your time today. And ladies and gentlemen, we hope you got a little bit more insight into Nuance's EHR services. And we do hope that you connect with us in one of these three ways to learn more about how we can help you best optimize your Epic EHR system. So with that, that ends our formal presentation. Thank you so much for joining.